Hi, my name is Ellie Russell and I'm a children's occupational therapist and I work for the Children and Young People's Therapy Service. Today we're going to be talking to you about what it is like to work for the Children and Young People's Therapy Service. So you might be watching this because you're looking into careers and jobs that help support children and young people with additional needs. Or you might be watching because you want to find out more about the children's therapy services across Somerset. The CYPTS team is short for the Children and Young People's Therapy Service. Within the CYPTS service, we have a team of children's physiotherapists, speech and language therapists, and occupational therapists. The CYPTS team work with children and young people from the age of 0 to 19 years old. We may work with a child or young person in clinic, we might see them at home, or we sometimes see them at preschool, school, or at college. So it's a really rewarding job working for the Children and Young People's Therapy Service, especially when you see the child and the young person meet their goals. We all have different experience and knowledge, and everyone is happy to share that with each other. And working for the Children and Young People's Therapy Service is a really great place to start a career as a physiotherapist, a speech and language therapist, or an occupational therapist. It's a really welcoming service and a great place to start a new career.
Hi, I'm Monica. I'm a children's speech and language therapist working for the Children and Young People's Therapy Service in Somerset NHS Foundation Trust. As children's SLTs, we help children with a variety of conditions, including learning difficulties, language delay, difficulties in pronouncing sounds, autism, hearing impairment, cleft lip and palate, stammering, voice disorders, selective mutism, developmental language disorders, and eating, drinking and swallowing difficulties. There is a lot of variety in my day-to-day work. For example, in my initial assessment clinics, I will see children and young people who have been referred to our service because of some difficulties either in their speech or difficulties with understanding conversation or maybe formulating sentences or perhaps with their social communication difficulties. So, for example, I may see a preschool child with very poor speech. And in the clinic, I will talk with the child's parents to find out about the child's development, and I will play with the child to make the session as fun as possible for that child. At the same time, while I'm playing, I will be making a note of their communication skills, what their attention is like, what their play is like, whether they understand what I say, and also how they say certain sounds. I may try some therapy with a child, so I can ask them to listen out for some sounds and words, or I will ask them to copy some sounds and words after me. If the child needs speech and language therapy, the parents and I will agree a suitable intervention plan. We may also agree to involve a therapy support practitioner who is going to deliver therapy for that child. In my specialist fluency clinic, I see children and young people who stammer. I may offer one-to-one therapy or group therapy, or I may train the parents and educational staff to do the therapy at home and at school and train them to make speaking easier for that child in general. On my school days, I will review the progress of children from a particular patch of schools, and these children are already on speech and language therapy caseload. For every child I see, I will write a report about their speech, language and communication needs or an intervention plan, or I may be asked to write a contribution to their educational and healthcare plan. I work in close contact with the children's parents, carers, teachers, and other health professionals. So for example, doctors, health visitors, school nurses, educational psychologists or children's social care workers. I may also work jointly with a colleague OT or PT or both from the Children and Young People's Therapy Service if the child has more complex needs. It was the mix of disciplines such as science, psychology, linguistics and medicine which underpin speech and language therapy and which I'm interested in. And also the fact that speech and language therapy can be a career for life because there is so many different career paths you can choose once you qualify. So when you qualify, you can work with both adults and children. When you work as an SLT, you can work in a clinical role or in a managerial role or in both, or you can decide to be an academic tutor or an academic researcher. The world is your oyster. Excellent communication skills so that you can motivate and reassure people of all ages. Great problem-solving skills, leadership and organisational qualities, and also you need to be happy to work alone and as a member of a team. Variety. I get to meet many different children and young people with many different needs, and I get the privilege to get to know them really well with their amazing personalities and their life stories. And it's immensely rewarding to be able to make a difference in their lives, to improve their communication skills so that they can show their true selves to others and express themselves with confidence. I also really enjoy being part of a very supportive and friendly team of other therapists and therapy support practitioners and admin staff. Look for practical opportunities to observe typical children's development and communication and try to get a better understanding of communication difficulties. So for example, you could volunteer in a toddler playgroup at your local children's centre or at a local stroke support group or at a care home.
Hi, I'm Helen Donovan. I'm a children's physiotherapist working with the Children and Young People's Therapy Service in Somerset. So today I'm going to talk to you a little bit about what physios do in the Children and Young People's Therapy Service. Well, physiotherapy is a healthcare profession that promotes the health and well-being of all. A physiotherapist helps to gain and restore movement and function when someone is affected by injury, illness or disability. It can also help to reduce your risk of injury and illness in the future. Physiotherapy can be helpful for people of all ages with a wide range of health conditions. Well, we see children from tiny babies up to adulthood. We see a huge variety of conditions, and some of us are specialists who have more in-depth knowledge about specific conditions. For example, we have a physiotherapist who knows a lot about children who have problems with their lungs and breathing, like a child with cystic fibrosis, for instance. Another specialist physiotherapist works close with the orthopaedic doctors for the children who need operations on their muscles and bones. These children may have a condition called cerebral palsy. Because a lot of our children are very young, we have to adapt our exercises into games and make them fun so children enjoy them and want to do them. So we also work in schools, nurseries and people's homes to help build children's exercises into their everyday life and to see also what a child might find difficult in a real life situation so we can support them in their independence and function. When we first see a child, they usually come to clinic with their parent or carer. We'll ask the child and their family what they find difficult and what they're worried about. We'll also ask about any problems they may have had before, the medical history, the family history, and all other professionals that they may have already been involved with. This builds a picture about what may be the problem. We look at how their difficulties are impacting on their development, function and quality of life. We then look at the child to see how they move about. We use our knowledge of normal movement and childhood physical milestones to see where a child is struggling or may have difficulties. We also look at how their limbs move to see if they have any restriction and tightness that's unusual. Lots of the time we use games to play and see how a child moves and interacts, as they cannot always tell us what's wrong. With our specialist skills and knowledge, we're able to make decisions about what we think is a problem and then work with the family and child to see what they want to be able to do and what they might find tricky. We can then set goals with the family and start treatment to help them reach these goals. Treatment may involve going to nurseries and schools to help support the child's needs. It may also involve blocks of specific therapy that's carried out by both physiotherapists and our therapy support practitioners, who also help support the schools and families with the child's physiotherapy programme. There are different options in training to be a physiotherapist. Most people do an undergraduate degree. Undergraduate options include a bachelor's and integrated master's degrees in physiotherapy. It's now possible to do a degree apprenticeship. During a degree apprenticeship, you work while you study. Some will do postgraduate degrees. Postgraduate pre-registration courses are available for those with a degree in related areas such as sports science or psychology. When you qualify as a physiotherapist, you then start to think about what area you might like to work in. Most graduates then like to rotate into different specialties to see what they like best. They will then specialise in a specific area. Well, if you like working with people and helping people, it's a really lovely career to work in. As a physiotherapist, you can be part of a great team helping people to become as independent as they can. There may be options for specialising, whether you're working with children, athletes, people in intensive care, people in surgery, older people, palliative care, and many more. The options are huge. As a physiotherapist, you see something different every day. You're always challenging yourself to meet the different needs and pressures of different situations. Physiotherapy is also a profession where you can travel and work in different countries. It can be a flexible job, allowing you to work different hours and even work as an independent private practitioner. There are always new things to learn and new opportunities to develop and change, as your life may also develop and change.
Hi, I'm Emily and I'm a children's occupational therapist in the CYPTS. Occupational therapists, or sometimes known as OTs, work with children who experience difficulties in carrying out everyday activities. We call these activities occupations, and they include play skills, self-care skills such as eating, toileting and dressing, skills needed for school such as handwriting and concentration skills, or coordination skills such as riding a bike and throwing and catching. We work to support children to become as independent as possible in these tasks. When working with children, we need to make sure our assessments and therapy sessions are fun and engaging, so we often use play activities to help children reach their goals. I trained to be an OT after leaving sixth form. I went to university to complete a 3-year undergraduate degree. During the course, I completed 4 different placements, working with adults and children in different hospitals and community settings. When you graduate, you are trained to work with both adults and children. A university degree is not the only way into OT. There's also an apprenticeship scheme where you can learn on the job. Prior to my training, I worked in a nursery, and here I became interested in child development and working with children with additional needs. This led me to look into OT, and I discovered it was such a broad profession that allows you to work in so many different areas. There are many areas in which OTs can work. There are multiple different teams, even just working with children. Alongside our service, there are OT teams that provide specialist equipment for children. There are also OTs working in teams that work with children and young people with mental health conditions. Though it is such a varied profession, all OTs work towards the same aim of increasing independence and supporting people to do the activities that they want to do.